Hello, good morning. Welcome to Time with Dr. Adams. Today, I want us to talk about things to do and things not to do when pregnant. Some of the things, actually, to talk about everything. In other subsequent episodes, we'll delve deeper into some of these things I'm going to talk about. Now, I want you to know that every pregnancy is different. The fact that you've had 4 babies doesn't mean your 5th pregnancy will be exactly the same as the first pregnancy. I see some women that tell me that, oh doctor, my first pregnancy, nothing happened. I didn't vomit, I didn't become big, my face was the same, the color of my complexion was the same. However, my second pregnancy is different. I think there's something wrong with me. No, there's nothing wrong with you. Every pregnancy is different. You can be perfectly fine in your first pregnancy and then have all the issues in your second pregnancy. It can also go the other way. You can have all the issues in your first pregnancy and then in your third pregnancy, you just go through like that. Just remember that every pregnancy is different. You can be big your first pregnancy and then in your third pregnancy, no one really notice that you are pregnant. I also want to tell you that the fact that you and your neighbor got pregnant at the same time doesn't mean you and the neighbor will have the same symptoms. So your neighbor is not having any symptoms and then you are having big feet, swollen feet. It doesn't mean there's anything wrong with you. We are all different. If you have any issues, don't consult your neighbor. It's fine to talk to your neighbor. It's fine to get advice from our family and friends. However, pregnancy, if you have real issues, just go talk to your doctor so that you know exactly what is happening. Every pregnancy is different. I cannot overemphasize this enough. Every pregnancy is different. There will be a reason why your neighbor might be kept in the hospital for 2 months, and then there will be a reason why you might be kept in the hospital for a month, or even be admitted at all, though all of you, the 2 of you, are vomiting. You see, both of you might be vomiting. She might be kept in the hospital for a month, and you might be sent home and seen as an OPD case. Why? Because every pregnancy is different. Don't copy people. Don't copy what they are doing. So you don't want to go to antenatal clinic and then you see your neighbor taking folic acid, Fosfolate, and some other medications, and you also want to sit at home and take that same medication. Do you know what is wrong with your neighbor? No. Just go to the hospital if you have a problem. ANC, that's antenatal clinic. It is very important you go to antenatal clinic because with this, there are so many complications you can get whilst pregnant. But if you attend ANC, these are regular visits to the hospital whilst pregnant. We will be able to pick up these things early and help you and your baby. Because believe you me, the goal of Ghana Health Service is to see mother and baby both alive at the end of the 9-month period. So we need you alive and we also need babies alive. So go to ANC. That means all your questions will be answered. I already talked about medications. Do not copy medications. Basically, folic acid is given to every pregnant woman. Fine. Immediately you find out you're pregnant, even before you go to the hospital, you can start taking your folic acid. Sometimes we advise that if you are getting ready to get pregnant, if you are preparing to get pregnant, you start taking your folic acid. I'll delve deeper into it in other episodes why we need these medications. But my point here is don't copy medications. Please do not take herbal medications. There's a place for herbal medications. Don't get me wrong. Don't say Dr. Adams doesn't like herbal medication. However, if you are pregnant, every medication that goes into you might or might not affect the baby, especially in the first trimester. So you want to take a medication. Your mother-in-law is telling you, baby, just come to the hospital with that say, we're explaining these things to you. Don't sit at home and take all medication. Your mother is giving you some, your mother-in-law is giving you some, your sister-in-law who has 10 children is giving you some. No, don't sit at home and do this thing to yourself or to the baby. Just come to the hospital and tell us your worries. Show us the medications that every one thing will be good for you. Show it to us and let us decide. Maybe you want to do some form of exercise. Tell us. Let us know. There are some women who cannot do some particular exercises because of the complications they're having. There are some other pregnant women. We actually encourage exercises in pregnant women. So we can tell you, just talk to us. Let us hear your consent so that we can advise you appropriately. Food, we want you to eat well. However, There are some kinds of food. Maybe you have your own medical history already. There are some kinds of foods that we might tell you to stay away from. But like I said, when it comes to the antenatal clinic, either you are seeing a midwife or a doctor, make sure to ask all your questions. We also encourage the men to also come to the hospital with their pregnant wives, because most of the times the men also have issues they want to ask. But when it comes to the men, I always know they'll ask about sex. Doctor, can we have sex whilst my wife is pregnant? Most of the time, I said most of the time. Most of the time, the answer is yes, you can still have sex whilst pregnant. However, there are some cases, there are some complications your wife might be having, and it might be the reason why we might tell you to stay away from sex for a while. But I won't sit here and tell you that have sex or no. Just go to the hospital. Tell your doctor your problems. Let the doctor examine you, and we will advise you whether you can have sex or not. Leave your questions and comments below. I'll be reading. If there's any topic you want us to talk about this season of Time with Dr. Adams, we just want to concentrate on pregnancy. So if there's any question, if there's any topic on pregnancy you want me to cover, kindly leave your comments below. I'll read it and get back to you. Thank you very much. See you next time.